Welcome everyone. We're so excited to kind of have you here today. Hopefully soon we'll be doing some of these in person, but I think that this virtual platform, a silver lining is that we do get to reach people from much further geographic areas, or maybe if people weren't able to take a whole day off work, you can still sign on for a little bit. So we're so thrilled you're here. I am going to share my screen and go through some of the basics that we consider crucial for preparing for medical school and some of the things you can do to put together a great application. I love Maryland. I love my job. Meeting you guys is one of the things I enjoy most. I'm one of the pulmonary critical care faculty, and I'm actually an alum of this school. So I went here for medical school and then fellowship as well. So this will kind of go through the basics of putting together a great application for medical school. And then you'll hear more about how amazing Maryland is, specifically from Dr. Martinez and Dr. Tom when they talk about the curriculum in our Office of Student Affairs, who we get to work with very closely. Okay, let's see here. So, I just need to get my camera and everything so I can actually see my slides because it's 2021. Last year at this presentation, I couldn't even get my slides up. So we've all come a long, or at least I've come a long way. I didn't know what Zoom was about a year and a half ago. Okay, so before you apply, is medicine the right career option for you? I've already told you, I absolutely love my job. I think it is an amazing job. I feel like every day I know what I'm doing is meaningful and I'm impacting both individuals and the profession. But being a doctor is not for everyone. It's an incredible amount of work. It is, the training is emotionally, sometimes physically draining, and it is very long. I think I got my first real career job in my 30s. So being a doctor is not for everyone. It is emotionally difficult. You work with sick people, which is also just, again, not for everyone, and that's fine. Like, there are so many ways and so many incredible careers where you can be impactful and make a huge difference that is outside of medicine or outside of being a physician in a different part of medicine. So we'll talk a little bit more about that when we talk about shadowing, but that is the very first question you need to ask yourself. I think that, I want to be a doctor is something that we all got kudos for when we were growing up. It was kind of a right answer, and many of us are type A who are interested in medicine and want to get that right answer. But why do you want to be a doctor? Something that ultimately you have to answer for yourself, because nothing could possibly be worse than getting into medical school, investing all that time and money and realizing that it's just not the career for you. So then, are you prepared? So academically, physically, emotionally, it is hard work. I think that there are many kind of analogies out there, but the most common is probably if college is drinking from a garden hose, then medical school is more like drinking from a fire hydrant. And I can say the steepest learning curve in most physicians' lives is actually internship, where I don't even know, a tidal wave maybe instead of a fire hydrant, like just so much information. Resilience, adaptability. It takes an incredible amount of resilience to be in one room and have something go terribly for a family or for a patient, and be there with that person and be somewhat emotionally available and connected with them, and then go see another patient that's in a very different place in life, maybe a very joyful time for them. And you need to have the adaptability and resilience to do that, to compartmentalize a little bit there, but then to go home or take time in your life to also spend time with those emotions and process them yourself. So this is all something that, in order to excel as a physician and avoid burnout, which we know is a huge issue, something that you really need to develop. Also, and I cannot emphasize this enough, work with your pre-med advisor. We do require a committee letter, which I will speak about later, but we work with these pre-med advisors. We meet with them, we chat, we tell them what we're looking for in applicants. They ask us questions. So make sure you're working with them, because they really do have a kind of backline connection with us and understand what it takes to put together a great application. Okay, so before you apply clinical experience, this is what I was getting at when I say make sure that this is what you want to do. So what counts as clinical exposure? Should you be in a setting? You should be in a setting with patients and physicians interacting together. So this is a clinic, an emergency room, telemedicine, all of those things count. It is also great to shadow a radiologist or pathologist, maybe people who don't have patient interactions as much, but we really do want to see that you've spent some of your clinical time, spending time with patients and physicians, seeing them interact together, being able to talk to physicians about the pros and cons of their jobs and how they've overcome some of the struggles they faced. This can be through physician shadowing. Scribing is, I think, a fantastic way to do this. You get paid, you're really in every single patient. You're in the room with the patient, the physician all the time, seeing how they're interacting, taking notes, learning some of the medical language, which is a different language than English sometimes. So yeah, I think scribing's fantastic, but shadowing is also terrific. Interpreting is another wonderful way to get this clinical experience. We don't have a specific time minimum or limit, but it should be substantial and meaningful. And I know that the SARS-CoV-2 pandemic is on the forefront of everyone's mind and is making it harder to get clinical experience. And I want you to know we recognize this. All of our careers and personal lives have been affected by the pandemic, and we are so aware that your ability to get clinical experience, especially over this past 12 months, was limited. That is a fact. But we also want to make sure that you have taken the time to really make sure that this is what you want to do. So we do need to see some clinical experience, but more so than ours is how you write about it. So tell us about that experience. Tell us in your application, tell us that story about why you're motivated to be a physician, and then how this clinical experience cemented that desire to be a physician. What the interactions that you witnessed. So hours don't matter as much as how you write about it. Before you apply, we also want to see people engaged in community service. Volunteering can be any type of service, not just medical. We have people who volunteer with vets. We have people who volunteer certainly in homeless shelters, both local and international. Again, we know that there have been some, as far as international experiences, those have been limited over the past year, but there have also been lots of new opportunities locally and even over helplines or texting to help support people. There are lots of different ways to get engaged. We want people to engage with your community and those outside your usual social groups. No matter where you come from in life, no matter where any of us come from in life, one of the crucial skills of being a physician is interacting and partnering with patients who are different than you are. And a great way to start getting that experience is through community service and engaging outside of your usual social groups. I say this all the time, that you can have the absolute right plan for your patients. So I do asthma. So I could prescribe the absolute right inhaler, but if that patient comes back and they haven't filled the prescription, they haven't taken their inhaler, it is so important to understand what's going on. Maybe they just didn't take it. Maybe their life was too busy. Maybe they were deciding between paying for heat for their family or food for their family and the very high copay. Maybe they feel like it is some sort of stigma and they don't want to see their friends do it, but you need to be able to partner with patients, put yourselves in their shoes, and come up with a plan that works for them. And in order to do that, you really need to develop that empathy and get to know people outside of your normal social group. Again, there's no minimum or maximum time for community service. It is a requirement, but we don't have a minimum time requirement. And so much of it is how you write about it. And again, when you're putting together that, when you're thinking about what it means to be a physician or why you want to be a physician, using these experiences to talk about that are terrific. One thing I really recommend is after you engage in any sort of community service is to write in a notebook or a journal or whatever you do, keep a Word document to kind of reflect about what that meant to you, kind of how that changed your perspective about the world. It doesn't all have to be about medicine, but write it down then, keep track of it, because sometimes looking back at things you did a year or two ago can be difficult. Again, we know this whole year has an asterisk. I'm sure we will talk about this in the Q&A part, but know that we understand opportunities for community service were shifted by the pandemic. So we certainly understand that as we're looking at applications going forward. All right, so before you apply, what about research? We actually do not require research for MD only, although some schools do, so be aware of that as you're applying. But it is a very positive addition to your application. And it is absolutely required for an MD or an MD PhD or MD master's program. This can be basic science or clinical research. And you can add, so if you, for people who have matriculated into our MD only program, later on, if they decide they want a master's, they certainly can. We are actively working on an MD MBA program with University of Maryland College Park that looks like it's going to go through. So that's we're just not 100% sure yet. So we're still actively working on that. But an MD MPH or any other MD master's program is something that you can elect to do after you've matriculated into our MD only program. I will say that all of our students do end up doing research. So background in research is terrific. I think that it is so important, no matter what kind of position you end up being or whether or not research is part of your career, the ability to read scientific papers, to understand what goes into good basic science research or clinical research is really helpful, and can certainly add to your application. All right, before you apply, get involved. So again, certainly to be successful in medical school, you need to be academically successful, but we also want to see people who are involved in their student groups, community events, leadership roles, teamwork. Medicine is a team sport. I work in the ICU a lot of the time, and when I round, I have a pharmacist with me and a nutritionist. We meet with physical therapy and palliative care and all of our surgical colleagues and other medicine consultants to help come up with great plans for patients. And this takes teamwork. It takes some sense of humility and also a lot of leadership skills. So getting involved early on in leadership, we like to see people who've gotten involved in leadership and who are team players, because there's no lone doctor that is successful. You have to have a team, whether or not you're a neurosurgeon or a pediatrician. Certainly you're working with staff, but also you're forming a team with your patient too, and trying to come up with the best plan for them. Paid employment, please let us know what you have done in terms of paid employment on your application. This is absolutely not required, but is seen positively. It's taken into account when considering involvement in other activities. So we know that some people have to work during college in order to pay for, other room and board or just other life expenses. And again, we just want to hear what this experience was like for you, what you've learned from it, how it may have contributed to your desire to be a physician, or how it made you a better leader, or better teamwork, or better with people. I mean, certainly we know that being a server in a restaurant is hard work. I worked in retail for a long time. It takes a lot of people skills to do that well. So kind of talking about that, and is your application is a great place to talk about that paid employment too. Don't think just because it's paid, it doesn't count. Before you apply, academics. So work hard in school. I think that this is probably, everyone knows this. Our average GPA is 3.76 and the average MCAT is 513. We do look at trends. So if people struggled their freshman year, but kind of pulled it together and did well in advanced courses, we understand that transitions are tough. All majors are welcome. So we love to see people from diverse backgrounds of all sorts. So any major is welcome, as long as you kind of do the foundational work in undergraduate to come into medical school with some basic concepts. AP and community college credits are accepted. Yeah, so I think that medical school is hard. The steps are hard. We only want to accept people who we think will be able to succeed in medical school, because again, getting into medical school and realizing that that you don't have the academic background to do it is incredibly difficult. All majors are welcome with these course requirements. So English, 2 semesters. This is more of any sort of writing intensive course. So we get a lot of requests, and we're kind of in process of broadening some of these definitions, but writing is important. It's important to be a physician, to write your notes, to just to communicate. So some English, biology with lab, inorganic chemistry, so basic chemistry with lab, organic chemistry. You can replace that second semester with biochemistry, and I do think that biochemistry is very helpful coming into medical school, and then physics with lab as well. On our website, we have more about this. There are other recommended courses. So immunology, I think, is another very helpful course, just to set up for some of the foundations that will help you be a successful medical student. How we review your application. So your personal statement, this is incredibly important. And we want to hear about who you are as a person. Tell us your story, explain your motivation to be a physician. Activity descriptions matter. So in the AMCAS application, make sure that you are talking about how each of those experiences, whether or not it was community service or shadowing or paid employment, kind of tell us about it and tell us how that's affected your decisions. Secondary essays. So we have a secondary application. We know that one of the things we ask is about your most important clinical experience. We know that that's going to be something from your AMCAS application. We don't want it to be something you've never mentioned in your application before, but don't copy and paste from the primary application or your personal statement. Make sure that you're giving a little bit more insight, looking at it from a different angle, telling us a little bit more about yourself and your experience. Letters of recommendation, make sure you ask people who know you and who will write you a strong letter. Get to know your professor. So I know I went to Virginia Tech undergrad, so we had big classes, but go to the office hours, get to know your professors, engage with them so that you are able to get those letters of recommendation from your faculty as you're applying to medical school. So application process. So the primary application is all through AMCAS to all schools. This is open, apply early. The AMCAS application includes transcripts, MCAT scores, your list and description of activities and a personal statement, as well as letters of recommendation. And we require a pre-health advisory committee letter if your school offers one. So if your school offers a pre-health advisory committee letter and you don't have one, that will be an automatic reject. So please, please, please work with your pre-health advisors. They are an incredible resource. Everyone gets a secondary application. So there is no, at University of Maryland do not do any screening prior to sending out our secondary. So everyone gets secondary applications. There are a few additional questions, a photo, and once again, please get this in early. We had almost 4,000 we had around 4,000 applications by September this year. We do holistic screens of every application we get. The earlier you get your application in, the better. So definitely try to get your secondary application in early. Interview early as well. So this year we will be virtual again. We will send you that invite to interview and try to schedule it as soon as works for you. Dress professionally, be ready to discuss all of the contents of your application, be on time, be yourself. I think that we all had some trepidation about virtual interviews going into this last season, but it really has gone very well. Our faculty have liked it. We've gotten positive feedback from our applicants. But really, dress professionally. Imagine that you're kind of in this person's office and having a conversation with them. So that is what I have for you regarding putting together the best possible application for medical school. This is our website and our email. We don't have any individual appointments, but we are happy to answer answer questions over email, as well as here today. So I'd love to hear some questions from you guys. You can write it in the chat box. Oh, and I see that Casey has already raised their hand, so feel free to unmute, and I can call on people as I see that up, unmute and ask whatever question you have. This is also our social media streams, which we are working on. So let me stop sharing my screen and then we can answer some questions. And Ms. Kareem, could you help me just make sure that I'm getting everyone? Oops, somehow I lost my view.
Yes, if you would like to start with Casey.
Great. Hi, Casey. How are you?
Hi, I'm good. How are you?
Doing well.
I just had two quick logistical questions, I suppose. The first was, I was wondering if the secondary application essays are going to be the same this year as last year, or if I should expect some differences.
They'll be the same.
Okay, great. And the other question I had was, I plan to submit my secondary as early as possible. However, my committee letter cannot be submitted until my summer grades are in like August. So I was wondering if that would affect when my secondary is processed, or like where that ends up in the pile.
So it does. So we screen applications once the application is complete, which includes the committee letter. However, I would still recommend getting your secondary in as soon as possible, because then the only thing holding it up is that letter of recommendation. And getting your application in as early as possible is important. August is also during the summer. So that is, our deadline is December 1st for secondary. So it's still well before the deadline.
Okay, thank you.
No problem.
Irvi, you're next. Did I pronounce it correctly?
Yeah, that's right. Hi. So I have a question for people who are specifically career changers, right? So for example, I've been working in the field for 5 years in a whole different career. It's hard for people like me who are career changing to do, volunteer work and other internships while working in the field. So how much weight can we put on the actual job experience versus like the volunteer work and the clinical rotations that we've gotten? Because it might not be as extensive.
Yeah. So I think that it depends a lot on what career you're in right now, and kind of just building that story thing. And our average age is around somewhere between 24 and 26 most years. Most of our students take time off. Some students come in their 30s or even 40s. So we have many people who take time off and many career changers. I think that how you talk about your work depends a lot on what you're doing right now. If people are involved in research, but you're seeing patients and, spending time with physicians and patients, like that can absolutely count as your clinical experience. If you are in the finance world and don't have anything to do with that, I mean, we really do want to see that you have had the opportunity to shadow physicians and really make sure that this is what you want. So when you talk about your job and your experience, it's really just a matter of making sure that being a physician is what you want to do and getting that experience. As far as community engagement, there are lots of different ways to do that. Again, it depends a lot on what career you're in now. If someone's working like with AmeriCorps, that's obviously like one point of view, but we do want to see, and I know that it's different than when you were in college, but we do want to see that people are engaging with their community and in groups who are different from them. But that can really look like anything. It doesn't have to be the classic college community service. And tell us what you did all the way back through college as well.
Okay, thank you.
No problem.
Next is Alexander.
Hi, thank you. So this is kind of a similar question about community engagement. So I'm from Baltimore and I've participated in community engagement opportunities in the past. So I'm kind of wondering what opportunities as a student I might have to engage with the community, and if there are ways to kind of propose new opportunities for students to get involved with the surrounding community.
Yeah, that's a fantastic question. So I believe, and we believe at Maryland, that being a physician really is a service-oriented profession. And we believe it so much so that we're required to get in, and then we have a required service learning, 40 hours of required service learning. This can look like anything. We have tons of opportunities through Scholars, volunteering with local schools and clinics. There are many organizations like the Optho Interest Group partners with Sight Savers, Pediatric Interest Group has Peds Pals. There are lots of different ways to get involved, even virtually. So cardiac coaches, so one of our cardiologists trains our students to help people talk about nutrition and lifestyle changes who might not otherwise have access to nutritionists and those types of support after they're discharged after a cardiac event. But we're also not restrictive. Like if there's anything you come to us with that you've been engaged with previously, it needs to be approved, but we love to see any new way to get involved with the community. So certainly anything you're currently involved with or want to be involved with is encouraged and celebrated. And if you want to start a new group around that, all you need is a faculty advisor to do so, even if it's an organization on campus that you're interested in starting.
Thank you so much.
No problem.
Next is Sneha.
Hi, thank you. Thank you so much for the information. You mentioned earlier in one of the slides about clinical experience. So you talked about scribing, you talked about televolunteering. How do you feel about CNAs? Like if you're working as a CNA, what is the time period that you feel gives a significant amount? If that makes sense.
Yeah. So I would say, again, like the time matters less. And I think as a CNA, it can mean so many different things, right? So some CNAs are right there elbow to elbow with their provider and rooming patients and, spending time with their provider, seeing patients, being part of that. And other CNAs aren't. Other CNAs are very removed from that process. So I think that certainly clinical exposure is great. So CNA definitely checks off all the boxes for clinical exposure, and talk about that, and talk about, there are lots of positions, EMT, where you're like really working with patients and learning so much about why you might want to be a physician. We also want to hear about you're kind of witnessing the patient-physician relationship, and that you've had some time to interact with physicians and talk about, the challenges they face, and what they love about their job, what some of their challenges are that they overcome. So it depends a little bit on what type of CNA. This is why the descriptions are so important. So tell us kind of what you saw, how that has affected your decision to be a physician.
Perfect. Thank you.
No problem.
Next is Jennifer.
Hi, thank you for the presentation. I just had a quick question about the MD MPH program. So you mentioned that research is required for the combined programs like that. So for the MPH program, would you say you'd have to have research in public health specifically before coming in, or in general, any research would still be looked at fine?
Yeah, so I would definitely reach out to that program to talk about your specific, and their contact information is on our website as well. And you can send them information about the current research that you're involved with. They definitely want to see an MPH kind of oriented application. Whether or not that is all research, maybe versus just clinical work that might be seen more, or clinical exposure that might be seen as public health. It doesn't have to be research, like it could be work in policy. So, if you we're so close to DC and Annapolis, but if you have work in policy, that can go towards a very strong MPH application as well. But I would say, like, if you've been doing cell culture research and PCR and ELISAs, like you probably want to have a little bit more of an MPH bent to your application than just that research.
Okay, that makes sense. Thank you.
No problem.
Next, correct me if I mispronounced your name. Is it Loriana?
Yes, that's correct. Thank you.
You're welcome.
So I had a question about the pre-health advisory committee letter. I just completed my MPH, so I'm kind of like far from my pre-health advisor in undergrad at Xavier University. So I'm wondering, how should I navigate the process of, this requirement, considering that I am not, in that arena anymore?
Yeah, so I think that there are two good options. One is just reach out to Xavier and see what they say. Say, like, I went there and I did my MPH, I'm applying to medical school now. I know that college, I can't remember how many years, but a lot of schools do 5 or 7 years out. And for your career changers out there, if you're past that time period, just let us know and give us letters of recommendations you have. But a lot of pre-health advisors will still help you, which will just be helpful for your application, and put together a letter for you. Sometimes that involves like practice interviews and stuff like that. Like, their input really can be invaluable even for alums. So that just depends on your pre-health office. Some schools for their master's programs also have support like that. So, if you have, even if it's not a pre-health committee per se, like if there's a specific advisor for your MPH, you can get, well, we would absolutely want a letter from them, but they might have some other resources or be able to put together a composite letter of some sort as well.
Absolutely. Thank you.
No problem.
Next is Michelle.
Hi, good morning. I have a few questions. They're quick. So I'm more of a non-traditional applicant. I worked as a scribe for a year and a half and then went back as an undergraduate postbac student to kind of get my GPA up, specifically at GW for the past 3 semesters. And I know that they provide committee letters. However, since I'm a non-degree seeking student, I'm not eligible for a committee letter. However, I have a letter from the pre-health advisors kind of stating that, and then if I was eligible, that I would be provided one. Is that all right? Like, should I reach out and just let the admissions know that that's my situation? And and kind of, what that has been entailed for the past year.
Yeah, so that letter that you'll get from your advisors at GW or the people at GW will state that, and that's fine. So you can certainly send us an email and let us know. But generally, when we look at their letters, we can tell that it comes from the post-bac group, and that is fine. Our requirement for a pre-health letter stems from a couple of places. Once, we want our applicants just to be as well prepared as possible, and and also willing to work with people to get into medical school. So kind of working with that pre-health committee really just sets people up for success, and getting engaged with them early helps put everything together for applicants. But certainly when you're involved with the post-bac program, they have so many resources, and their letter counts for your committee letter.
Okay, great, awesome. And then my second question is, when I was a few years ago, when I was an undergrad prior to entering my senior year, I actually did research at the University of Maryland School of Dentistry. And I just was wondering if, there are opportunities for if I wanted to get involved in that lab again, assuming I was admitted and accepted into the School of Medicine, if there were opportunities where I could work with the School of Dentistry in doing research.
Yeah, that's an awesome question. So we'll hear a little bit more about this from Dr. Martinez and Dr. Tom, but we do have a research requirement for all of our medical students. We believe that it is important for medical students to kind of understand, or for physicians to understand what goes into research. People, kind of the minimum requirement is a 10-ish week project with an abstract at the end. Obviously, many of our students do far more longitudinal research, either with a master's or just get involved in their first, second, and fourth year. Third year is a little clinically busy. So if you're on the 4-year track, the first, second, and fourth year tend to be when you have more opportunities. We have a list of close to 1,000 different projects on campus for students to get involved with that are specifically tailored towards students. If you have research connections, certainly at the dental school is fantastic. And a lot of School of Medicine faculty partner with the dental school, or if it's just a dental school, we also have a school of pharmacy, school of nursing. Research in any of those schools is great. Also, if you have previous research connections with NIH or Hopkins, we're lucky to be in the Baltimore-Washington corridor where there are so many phenomenal research opportunities close by. If you want to go back and work in those labs or with those groups, that is also very acceptable. We just, again, like, you don't need to do our research project. We just want people to be involved with research and have that experience. So that's a long answer to say yes, you could do your research requirement in the School of Dentistry.
Okay, great. That's great to know. Thank you so much.
Next is Brian.
Thank you. So I'm a late career changer who is trying to take some of the hard science classes that I didn't take as an undergrad so many years ago, and have heard from a couple schools that that in some cases they won't consider those credits unless they're taken on a full-time basis. I'm wondering if a similar situation applies here, where it kind of, rather than kind of doing it one at a time, they sort of need to be taken all at once to sort of simulate the experience of a pressure environment.
No, so you're more than welcome to take those over time in a part-time manner. We do encourage students to kind of finish the program within the past 5 years, again, only to set people up for success. Courses you took 10 years ago are not going to be helpful in all likelihood for classes you're taking now. But as long as it does not need to be full-time, it absolutely can be part-time. And we absolutely look at those, or those credits absolutely fulfill our requirements.
All right, next is it Rajan?
Yes, it's Rajan. Good
Hi,
morning,
Rajan.
Dr. Robinette. So I have a question about the MD PhD program. I understand that you guys have the MSTP program, but I was also wondering about the other routes that a medical student could take to get the dual degree, and if you guys had multiple routes that were funded. So I understand that the MSTP program is fully funded, but do you guys have other routes as well that are also fully funded?
So no, I think is the short answer. All of our students who get an MD, PhD go through the MST program.
Okay, and I have two other questions. I'm sorry. So
Sure, no,
my
that's fine.
okay, sounds good. Do you guys accept the MSTP students yearly, or are there some cycles that you aren't accepting them? Then my other question is, could you explain the curriculum of the MSTP program, like the breakdown of it really quickly? Thank you.
Yeah, absolutely. So we accept MST students every year. The numbers vary, but it's around 10 to 15, I believe, is usually how many matriculate. And correct me if I'm wrong, Rishana, I may have gotten the number wrong, but it's around that number.
Yeah, you're right.
And
It's around 10 or 12, 10 to 12.
10 to 12. And it really depends on, there's not like a set, well, there's a set number, but it's more just kind of how many applicants we get that we feel like will be successful. The first 2 years are basically the same, and then students step out for about 4 years, give or take, to do their research. There is a kind of longitudinal clinical exposure through that time, and certainly there are things once you get on campus where they kind of with the MD-PH group, even before you start your PhD, ways to engage with them. So you step back into your third and fourth year when you're doing the MD PhD. The MD Masters almost always steps out after third year. So you get through the first 2 years in your clinical rotation, your core clinical rotations, or clerkships as we call them, and then step out before you come back to do your fourth year, which is more focused on electives and applying to residency. But for the MSTP, for the MD PhD group, you step out after your second year.
Thank you so much, Dr. Robinette.
No problem.
And Clarice?
Hi, good morning. I have a quick question about clinical experiences. So I have a significant amount of hours working as a PT aide in, throughout high school and throughout college. So this has really been a significant part of my medical journey. I was wondering where I would put that on my application, since it's not directly working with doctors, but I am directly working with patients. Would that be considered clinical, paid, or something else?
Yeah, so I think everything would be listed as paid or not, but that I would definitely list it as clinical experience, right? So that's a great way to get, knowing you want to work with patients is a huge step in the right direction. So because that can be challenging and is important to know, but like the PT aid, EMT, CRNA, all those things, if it's really you working with patients, or even clinical researchers, sometimes you're really spending time with patients, that is so important. And we want to hear about how that has helped you decide that you want to apply to medical school. You just also need to have some experiences where you have been able to kind of witness the patient-physician relationship and some of the unique vulnerabilities and everything associated with that relationship. So I think that is wonderful. Definitely tell us all about what you did and how that's influenced you. And we'd love to hear all about that. It's just, we also want to see, on top of EMT, PT aid, all of those types of patient clinical experiences sometimes spent with physicians.
Okay, thank you very much.
No problem.
And we'll just take one more question before you move on to the next presenter. So Loriana, if you want to take it away again.
Yes, so I heard you mention AmeriCorps, and I'm kind of on the fence on how I should represent AmeriCorps on my application, because it is a volunteer experience. However, we're paid a stipend and an educational award. So should I, so I did 2 years, 2 terms. How should I, acknowledge that on my application as volunteer or as paid employment?
Yeah, so I think most schools, not just us, are familiar with what AmeriCorps is. So I would probably put it as a paid experience, but obviously it is paid very little. Yes. And, and is more community engagement. So just all of that should come out in your discussing it as an experience, yes, though. So I don't think it matters so much whether or not you list as community service or paid. It's really going to be the fact that you did it says a huge amount, and then how you talk about your experience.
Yes, because so my AmeriCorps term was actually clinical as well. So I was in the public health field. We were the first class of the public health AmeriCorps. So I guess I don't know, like it's clinical, volunteer, paid, but I shouldn't list it on each individual. I should just list it as paid and then talk about it more so.
Yeah, and I don't think it matters which one you choose for the title. You know, there's tons of space to talk about it on AMCAS, and then pretty much in every second, I'm sure you will have opportunities to talk about in the secondaries for every school you apply to. So it's much more kind of how you talk about it than how you categorize it.
Right.
No one would criticize you for, like, we know there's tons of overlap for so many of these activities. So which title you choose matters a lot less than how you talk about it in the long run.
Great, thank you.
Okay, we'll take one more because I see one more hand raised. Is it Line or Lean?
Lane.
Lane, okay.
Yes,
Take it away.
Lane. Hi. I have a quick question regarding being a reapplicant. My question is about the essays and the work activities. See, if you said that you mentioned that the secondary might be the same, right? Let's say it comes the same and we are a reapplicant. Should we rewrite the essays, or we can just submit them as we did the same essays that we did previously?
Yeah, so that's a fantastic question. So I would say, and a lot of people are reapplicants out there, and we know it's really hard to get into medical school. We really want to see when people reapply that you've completely reworked your application. There are a lot of reasons people aren't successful when they apply to medical school, and we know it's incredibly challenging, especially last year. There are more applications than ever, but medical school is a huge commitment, and we kind of want to see applicants that are kind of committed enough to applying that they've reworked all of their essays in both their AMCAS and their secondary.
Thank you.
No problem.